Well, my topic is a little bit different than what you have heard. It's telemedicine. It's a very broad area, but I'll keep my talk focused mainly on STEMI and telemedicine. It's a very broad definition, but the WHO defined telemedicine as delivery of healthcare where distance is a critical factor by healthcare professionals using information and communication technology for the exchange of valid information in diagnosis, treatment and prevention of disease and injuries, and for continuing education of the healthcare provider as well as research and evaluation. So it involves clinical medicine plus exchange of medical knowledge. There are two main methods where telemedicine can be performed. One is asynchronous method, where information is stored and forwarded, like you store the information and send it to somebody. The other one is synchronous or real-time interactive video, where patient is being examined and the other side, the expert, is giving some feedback. Now, this is a broad area, so American Telemedicine Association came up with some guidelines in order to make some uniform system, that what are the uniform system services they have to follow for all the patients all across the board. At the same time, you have to know, the provider and the patient both have to know what are their expectations, and then exchange of the information using the information and technology. But the problem with this American Telemedicine Association guidelines are that these guidelines are only specific to the United States of America. Whether the recipient or person delivering the care, both are in the United States. That's the difference. Telehealth and telemedicine both are used interchangeably, but telehealth is use of medical information exchange from one side to other, whereas telemedicine is what we do every day, like diagnosing. Somebody sends you the data, you diagnose and give some treatment guidelines. But people can use telehealth and telemedicine interchangeably also. But basically both involve the use of some kind of a information technology media, such as video conferencing, mobile phones, those kind of things. Now, the American Telemedicine Association has different guidelines. There are administrative guidelines, clinical guidelines, and technical guidelines. The administrative guidelines for organizations are mainly which involve human resource management, privacy and confidentiality, federal state rules, what apply to delivering facility and the receiving facility, ownerships of the patient data, fiscal management, all those things, and what are the research protocols, what are the evaluation criteria to maintain good quality. At the same time, the organization have to maintain some accreditation or regulation which apply to that particular state where the care is being given. At the same time, there are some administrative guidelines for healthcare professionals also, which means you have to make sure that the professional has the required credentials, CME requirement, licensing, all those things, and they know what the evidence-based evidence-based medicine standards are, all those things. At the same time, the administrative guidelines for the healthcare professionals state that they have to maintain and make sure that the workspace is secure, soundproof, and has lockable doors. It's not that you're talking to somebody and your wife and your kid is walking into the room. You can't do that. Same way, there are clinical guidelines, which means the healthcare professionals are aware of the professional guidelines and following the guidelines when they give any opinion. At the same time, the host facility has to verify who is the patient and who is the person giving the information. So all those things have to be taken into account. At the same time, the clinical guidelines state that the provider has to reveal their location. You don't have to say that you are at home or sitting in your bathroom or in the kitchen, but you have to say which state or which hospital you are from. Technical guidelines basically specify what kind of a computer you should have, what should be, like for example, the internet-based video conferencing, the minimum bandwidth should be 384 kilobytes per second, both uplink and downlink side. At the same time, the minimum resolution should be 640 × 480 at 30 frames per second. So there are specific guidelines. At the same time, wherever you are taking pictures, doing audio, video, the place has to be secure and use encryption. Now, coming to the main topic, how does telemedicine applies to low middle income countries? Well, first of all, you have to know what is the definition. This information is latest from July 2016. The WHO and United Nations do not have any definition. All they do is they depend on the World Bank data about how to define what is a low income country, or which is a low middle income country, or a high income country. The low income country is $1,045 gross national income per year. It's annum. Low middle income country is $1,045 to $4,125. This is US dollars. The low income country, it used to be $1,025, but it got upgraded to $1,045 in July 2016. And again, upper middle income countries come into $4,125 to $12,736. And high income countries are $12,736. So whether it's OECD or non-OECD, it's the same value. Basically, it's 1961, the French people made an organization to do business with 34 countries. That's what OECD was. So if you look at this map, that tells you which are the low middle income countries. Basically, if you look at the map over here, India comes into the low middle income group. That's where it comes. Now, the WHO published a bulletin in 2012, which basically identified 3 different areas. And in the interest of time, I'll go a little faster. Basically, what they say is that all these systems, they improve the performance of the physician, they improve the follow-up by the visits by the patient, and they improve the hypertension and glycemia controls also. So now, what is the current status or future status in of the telehealth in developing world? Well, the problem with developing world, first of all, there is no definition of developing world, underdeveloped country. There is no definition. Actually, WHO is saying drop it. We just go by the gross national income product. But basically, the developing nations always have few resources, and in cardiology, the most common way of telecommunication or telecardiology is transmitting EKGs. That's what it is. Developed versus developing countries, there is an interchange. The developed countries have access to all the technology and everything, but at the same time, most of the help is needed in the developing nations. For example, Africa has the highest global burden of disease, yet they have the least amount of healthcare workers. But at the same time, the developed countries cannot say that it is not our problem, because nowadays people globally travel all over, and therefore it is the interest of developed countries to help the developing nations. And actually, developing nations also can help by what you call reverse innovation, because developing countries have limited resources and they know how to cut the cost. So they can be helpful to the developed nations. These are some studies basically, like this was a study from Mali, where they showed that with the help of telemedicine, the diagnosis in cardiology improved, and it was correct in 92% of the cases. Patient management improved in about 96% of the cases, and patient did not have to travel too far, so there is a cost saving also. Same way, this was a study by Dr. Samir Mehta, who made this Latin Lumen America's telemedicine info network, which is like a hub and spoke policy. Basically, the hub sites, patients get transmitted. If they have a STEMI, they go to the direct to PCI, where the spoke sites, they are given thrombolytic therapy. That's what this is. Then there are some integrated regional networks made for STEMI in the developing nations, which involves paramedics who transmit the EKG via telemedicine, and then the regional network, they decide which patient is having STEMI, whether they should get thrombolytic therapy or whether they should go to a PCI facility. So they showed that in 14 months there was significant improvement. This will surprise people who are from US, that the median time from admission to EKG was 159 minutes. That doesn't happen in USA. But still there is a lot of room to improve. The bottom line is telemedicine has a role to play, and it can improve the communication and transmission of the data. Now India, how does India applies to this thing? India has a lot of mobile phone users, but there are no specific guidelines. There's a lack of privacy. Patients don't know, the lack of informed consent, and there are a lot of other resources are lacking. And at the same time, there are some legal challenges. Liability, who's liable? Well, in the government-sponsored programs, it is the receiving facility which is responsible if something goes wrong, not the person who's telling you what to do. State regulation, well, the healthcare is a state problem, but the policies are made by the federal government. That's a problem. Security is a problem about patient information. Reimbursement system does not exist. So these are the things which India is facing the challenges. So what we need in India is a Telemedicine Act, which will take care of all those things. Privacy, there will be uniform system to all the patients, whether it's underprivileged or privileged. So this is the process in telemedicine in India which should apply. Patient and primary doctor are the main people and expert. Any of these guys can call a telemedicine system. There should be a telemedicine system they can call directly, or patient talks to primary doctor and they call the telemedicine center. And then the telemedicine consultancy center can refer you to the specialty center, and they can refer you to whether the patient needs to go to PCI or go to thrombolytic therapy. Conclusion is, whether like it or not, telemedicine will be a part of regular healthcare system in India. It will benefit both developed and developing nations, and it will significantly improve the care all across the globe. And I think STEMI network, making a STEMI network is the main thing to go for. Thank you very much.
Last but not, thank you very much. Last but not least,